Henry Graff in just a moment. But first, on your side at 6, John Hood explains the request Virginia hospitals are now asking of you tonight. John?
More than 2,100 Virginians are being treated for COVID-19 in hospitals around the state. This as staff are continuing to battle what they call a fifth surge. They're asking those with less severe COVID-19 symptoms to try and avoid emergency rooms.
Basically, the past month, we've gone from 922 hospitalizations on December 1st for COVID-19 to more than 2,100 hospitalizations today. So that's a 128% increase in the space of about a month.
As hospitalizations continue to spike, hospital leaders say only those who are experiencing severe symptoms like difficulty breathing, chest pain, and an elevated temperature over multiple days should head to the emergency room. VCU Health says it's not uncommon to see an uptick in patients in the emergency room after the holidays. But what is uncommon is to see people asking for COVID tests.
People are coming in for mild illness or mild symptoms, whether it's COVID-19 or the flu or other seasonal illness, or people just coming in and saying, I can't find a COVID test anywhere else at my local pharmacy. Can you give me a COVID test? And unfortunately, what that does is that just places additional strain and burden on a system that's already dealing with a lot of strain and burden.
Emergency departments will not deny care, but if you're experiencing a light cough or sore throat, they ask you to stay at home, isolate, and wait to get a test at a testing site. When comparing current numbers to last year, health officials expect it to be some time before hospitalization numbers start to go down.
Again, what we're just looking at is precedent and saying that if this pattern mirrors patterns that we've seen before, including the pattern we saw last year in and around the holiday period, the expectation would be that these numbers may continue to climb for another few weeks before they start to recede.
Walker says those hospitalization numbers are not as bad as they were this time last year. He says that's due in part due to the COVID-19 vaccine. On your side in Richmond, John Hood, NBC 12 News.
We're on your side at 6.